More Republican governors are revolting now against the president's health care law, specifically the provision that expands Medicaid, allowing millions of Americans to rely on the government for help. Does that undermine the entire purpose of the law? Let's ask Dr. Bill Winkenwerder, former CEO of Blue Cross Blue Shield and president of Highmark Health Insurance, and Stan Hupfeld, former hospital CEO and author of Political Malpractice. Good morning, gentlemen.
Good morning. Happy 4th.
Doctor, happy 4th to you. Happy Independence Day. Doctor, what do you say about the Republican governors stepping out and saying, we're not going to fund this expansion, we're not going to be setting up these healthcare exchanges in our states? Does that devalue the entire Obamacare? Is that what should be happening?
Well, the part that you're talking about has to do with Medicaid and whether they will expand their Medicaid programs. And yes, several governors have said that they do not believe that there are the funds available to do this. They're concerned about the long-term cost in their state and where the taxes, the revenues will come to pay for this expansion. And so they're concerned, even though the federal government will pick up the costs of that expansion during the first few years, they're concerned about the long-term costs. And so we'll have to see what they do here, especially given that, you know, it's certainly possible that things could change with the upcoming elections, but that remains to be seen.
Well, what do you say about this, Mr. Hupfeld? It appears that in the law there was an opt-out for the states to say we will not be part of this Medicaid expansion, and the Supreme Court agreed that they could step out and not be penalized with the taking away of current Medicaid money. What's going to happen to Obamacare if 26 Republican governors say we're not in?
Well, that's one of the real ironies of the Supreme Court decision. You know, the support of many of the provider groups, including hospitals, was based on the fact that all of a sudden we'd have an insurance program for many of the people we're taking care of for free now. So, and much of that was coming from Medicaid expansion. So, if in fact the governors follow through with their allegations, this would severely damage one of the main tenets for which many of the provider groups were supportive.
Doctor, what's going to be the outcome if, in fact, these governors step away from the Medicaid expansion? How will this affect the system nationally, and how will it affect the provision of health care to people who may need it and are not getting it?
Well, Peter, I think what you're referring to is in the original law, they were mandated to expand that coverage under Medicaid, and if they did not, they would lose all of their Medicaid funds, not just the funds available for that expansion. So I think the states are, what I hear in following this issue among the states, and really all states, is they want more flexibility to manage their Medicaid programs and not so much direct control from the federal government. And with that flexibility, they believe that they can expand coverage but do it at a lower cost. And so we'll have to just see how this plays out.
Mr. Hupfeld, do you believe the states have a moral obligation to put these folks on Obamacare, even though they have political objections to Obamacare, based upon what we're seeing now?
Well, I think the states are going to be under a great deal of pressure from neighboring states that do participate. You know, if in fact a state chooses not to participate and expand its Medicaid to 133% of poverty, we sort of go back to square one, and we're not necessarily worse off than we were before. But many of the provider groups would be significantly disappointed.
We'll leave it there. Dr. Winkenwerder, Mr. Hupfeld, good morning. Happy 4th. Nice to see you both. Thanks for joining the debate.
Happy 4th to you. Thank you.
Be well.
Thank you.